Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to go over a nerve flossing or nerve mobilization technique that may be helpful with certain types of pain and discomfort that you might have after knee replacement surgery. Before I jump into that, please hit that subscribe button, turn on the notifications to catch all of our latest videos. So for this video, specifically, we're talking about your peroneal nerve, or it may also be referred to as your fibular nerve. Now this is a nerve that branches off of your sciatic nerve, the very big nerve that comes down through your back, through your low back, the back of your leg, and into your lower leg with a lot of different branches. Now your peroneal nerve or your fibular nerve provides innervation to the lateral part of your lower leg, your shin, and the top of your foot some. So one of the common things that you may experience, particularly with knee arthritis or after knee surgery and knee replacement, is some achiness, some pain. You might experience some numbness and tingling sensation a little bit. And if it really is progressing, you may even notice a little bit of weakness. So weakness with everting, or bringing your foot out to the side, or dorsiflexing, or bending your toes or flexing your toes toward your head. What can happen is the nerve can get irritated through inflammation, through swelling, or just through certain surgical things that may happen. So what I want to show you is a nerve glide or a nerve flossing, a couple different techniques we can do. And what that means is nerves run throughout your whole body, through your legs, your arms, throughout your body, and they have to be able to move and glide just like other soft tissue and other components of your anatomy. So what you want to think about sometimes is how a piece of floss moves as you're flossing and flossing your teeth. That's the same kind of way that a nerve has to move and glide through the muscle, through the fascia and soft tissue of your leg or your arm or wherever it may be. Now when a nerve is irritated because of swelling, because of the trauma of surgery, whatever it may be, that nerve might have less mobility and not be moving and gliding as well, and that may be a cause of some pain and symptoms. So nerve flossing and nerve glides are just one strategy that you can use to help improve that mobility of the nerve, decrease some of the irritation, decrease some of the sensitivity. If you want to see some nerve glides for your femoral nerve along the front of your leg, and specifically for your sciatic nerve, check out some of the other videos on this channel. So let's get into showing you the exercise. I'll leave that here. So one of them you can perform in sitting. So this is one where you're going to start with a good posture. There's a couple different variations, different ways you can play around with this. But the way to tension your peroneal nerve fully is to slouch down, and then you're going to straighten your leg up in front of you, and then you're going to invert your foot, so bring your foot toward the middle, and then plantar flex, which is push your toes away from your head, so pushing downward. So it's straightening the knee, push down and in with your foot. And you'll feel that little bit of pull or stretch even if you don't have this irritation. And then when you slouch and bend your neck, that's going to tense all of those nerves completely. It's going to stretch them out fully. So this would be the complete tension, would be slouched, neck flexed, and push up, down and in with the toe. Now a couple exercises or nerve flossing things you can do is just tensioners, we call them. So you tense the nerve and then release it. So you're going to go all the way to that fully tensed, and then just relax and sit back up. Fully tensed, relax and sit back up. Another option is trying to do that flossing, so we tense one side but not the other. So for example, you're going to tense this side, but you're going to keep that posture. So keep that upright posture. We're not going to tension it at the back and the neck. And then when you come down, you can go into that slouched. So it's going to look like this. So those are just two variations from a seated position. Things to keep in mind is, one, it can be very easy to really irritate the nerves and cause increased discomfort and symptoms. So you want to keep it at a very moderate to low intensity. Only do maybe 10 repetitions at a time, nice and slow and controlled. If you're having very significant burning pain, very significant irritation of that nerve or of that area, I definitely recommend consulting with your personal physical therapist, consulting with your doctor before trying any of these. Slow and controlled, nice and easy, because it is very not too difficult to irritate that nerve even more, which of course we want to try to avoid. So let me show you one lying down. Again, there's a couple different things you can do, but I'll just show you a few of them. So one is we can just bring the leg up, and you can hold it here with your hand, or you can put a strap around. And you're just going to straighten, and then you're going to push the toes away from the head and toward the middle. So that tensioner again, and then bring back down. Straighten, push the toes toward the middle and away, and back down. Again, you can incorporate the head and neck, so you can do full tensioner, bend the head as the leg comes up, or you can do just tension one side and not the other. So as you come up, it's like this, and then as you come down, you bend the neck. Same rules apply. Slow, controlled movements, not trying to go into too intense of a stretch, trying not to over-irritate the nerves. We're just trying to get a little bit more movement, get a little bit more motion, and start to get that mobility back in the nerve. And hopefully by doing that, in incorporation with some other exercises and things, you'll start to notice less discomfort, less pain. Again, this is specifically, these ones are looking at your peroneal nerve that goes kind of behind the head of your fibula on the outside of the leg, down the lower leg on the outside, a little bit in the front on the shin, and kind of in the top of the foot some. So if you're having that irritation, that achiness, that numbness, that tingling, or even maybe a little bit of weakness in that area, it might be good to look at incorporating these exercises or these stretches or nerve mobilizations to help aid in relieving those symptoms and that pain and discomfort. I hope you found this video insightful. Please be sure to leave your questions, your comments below. Tell me where you're confused, tell me where you got wrong, or what I got wrong. This does take a little bit of mental gymnastics, so to speak. So definitely leave your comments, your questions, and feedback below. Please be sure to hit that like button so other viewers can watch this video. Thank you for watching.